Hi friends, today I want to talk about chronic urinary tract infection for my new Instagram followers to inform them, to give them some idea about the procedure, what we do for chronic urinary tract infection. Thanks to Marnie and Casey, my dear friends, which we treated for the same disease and we had a good solution for their chronic problem. Marnie recommended me in her Instagram page, and after that many people begin to follow me, and I feel myself responsible to give some them a clue about what we are doing in our procedure, what is the solution for this chronic urinary tract infection. So excuse my English, as you can understand, I'm a foreigner, I'm not a native English speaker, so excuse my mistakes and unfluent speech with you. So we have a surgical solution for chronic urinary tract infection. First of all, I want to mention this is very different from interstitial cystitis, which is a very different and difficult situation, chronic disease of bladder, but not an infectious disease. This is the losing capacity of bladder because of the losing its inner coverage layer, glycosaminoglycan layer, and feeling constant pain and having a decreased bladder capacity continuously through all their life. So there are different solutions like enlargement of bladder and giving some special drugs for it, but it is well accepted among all urologists, and the procedure is all the same in all over the world. So there is no other and different solution of us to treat interstitial cystitis. But for chronic cystitis, we have really different and good solutions. This is the fulguration of some abnormal tissues in the bladder, which is formed in the beginning of chronic urinary tract infection many years before, when the patient had first this unwanted event. So what we do is we make a cystoscopy. I have many patients from Britain. They had previous cystoscopy and they say nothing is abnormal in the bladder, but what urologists think normal is not always normal. There are some tissues in the bladder. Actually, there are two kinds of tissues. One is leukoplakia tissues. They are puffy white cells. I want to show them if I can. We find in the bladder, and the other is trigonitis. Let me show you. So this is a normal bladder. These are normal, but this part is, these puffy white tissues are leukoplakia tissues. They are not normal. If you look again, these are normal bladder wall, and here these are in the entrance of the bladder. These abnormal tissues are they developed because of the chronic infection or the first infection this woman had. When these tissues changed, they get prone to get infection. Bacteria can hold this tissue more easily because normal bladder mucosa is slippery for bacteria. They cannot hold into these normal areas. But the other infected area, the tissue is disturbed and bacteria can find easy ways to hold these tissues. So we understand previously that these abnormal tissues are the main cause of urinary tract infections. Sometimes, if they are not treated for a long time, they become more and more dense. And look here, there are also tissues. These are leukoplakia tissues. This is normal bladder mucosa, but here there is a dense white plaque tissue which bacteria can hold easily. So we resect these tissues. If there is, when we make cystoscopy, if there are leukoplakia tissues, the success rate of our procedure is 90%. If there is no leukoplakia, there is only trigonitis, which is the red inflammation of normal bladder mucosa. We make a deeper resection, and the healing period is a little bit longer and the response rate a little low. Previously, I was doing the same procedures for both of them, and the leukoplakia healed 90%, but trigonitis 60%. Overall, we had an 80% success rate for these chronic urinary tract infections. But now I am making a deeper resection for trigonitis and the success rate increased significantly. But the healing period is a little bit longer. We use the same equipment we use in prostate or bladder cancer resection. With these instruments, we make a superficial tissue fulguration. If you want me to show, let's look at this. These are the tissues we want to get rid of, and with this instrument is used for look here, some of the tissues are fulgurated. This is the fulguration of tissue. This instrument, we use it in prostate resection or bladder cancer resection. So we very superficially fulgurate the unwanted tissues. They go away and normal bladder mucosa heals over this tissue, and when it is normal, it becomes as normal as the other mucosa of the bladder. It is slippery and bacteria cannot hold into these tissues. So as you see here, maybe here more easily, we try to get rid of these unwanted white plaques or red inflammatory trigonitis cells. This is a very superficial treatment. I tried them, many kind of treatments. Sometimes I made deeper resections previously, but the healing was longer. So main aim is to get rid of these tissues, and we make these fulgurations. So we have nearly 10 years experience in these cases. We treated many patients and they are happy. But not all the women are real candidates for this procedure. My real candidates are those women who had their first infection when their sexual life begins, or after their pregnancy, or after their menopause. So something in their life changed and they get prone to, they had tendency to get these infections. And the best candidates who had benefit from this procedure is those girls who had very much urinary tract infection tendency from their childhood ages, from their adolescent ages, and when their sexual life begins, they have common urinary tract infections. After sexual intercourse, their episodes become worse and they are treated by antibiotics, and after some period, some weeks, the infection happens again. And as our solution works, I want to say normal urology doctors in normal urology world, this is not a commonly accepted procedure. We always see leukoplakia tissues, but it's not accepted as the main cause of chronic urinary tract infections. I first noticed this problem in my endoscopic stone operations. When I go inside the bladder to go inside the ureter to find the ureteric stones, I see that in some women there are abnormal tissues. And when I talk to these people, I understand that these are the people who had chronic urinary tract infection and they are not treated. The urology world do not recommend to take these tissues out. And I tried and I was successful. I see that getting rid of these tissues heals the chronic urinary tract infection. So forgive my English, this is a little bit long summary, but our procedure is this. We are applying this procedure for 10 years, and if there is leukoplakia, 90% success rate. If there is trigonitis, our rates was 60% success, but nowadays it is a little bit higher. the new results will come soon. Thank you very much for your listening.